Hello everyone, today we will discuss how to study pharmacology. I get these questions from new students. Sometimes they are overwhelmed, they don't know where to start, how much they have to study, what to study. So in this video, I will discuss or share my 6 tips on how to study pharmacology. My tip number 1 is you have to take notes. During the class, probably you are having some lecture handouts, and take some notes what has not been written in your handouts, something extra during the class that has been talked about. And then after the class, what I suggest is to just look at your textbooks and find some supporting information that is relevant to you, and then write down your notes. And while making your notes, handwritten notes are better than electronic notes because you can memorize them better. And then you can, during taking the notes, you can make tables. So tables will make the work easier for you. Something like this you can make, like on one of the columns you can put down the drugs, and then in another column you can put down the mechanism of actions, adverse effects, contraindications, drug interactions, or any other important clinical note you want to take. You can make a new columns, and after filling out the table it will look something like this. So when you are done with this exercise, then next time you don't have to read your books or lecture handouts. You can directly look at your notes. So it will help you to save some time. And my second tip is you have to focus. So you have to know what to study in pharmacology, what you are expected to know. For example, so we expect you to know the prototype drugs. What are the prototype drugs? Like in case of H2 blocker, it's ranitidine. In case of proton pump inhibitors, it's omeprazole. So you have to know about these drugs, why these drugs are given, what's the indications, what's the mechanism of actions, how these drugs work. And then also you have to know any information which is related to patient safety, like whether this drug has any serious side effect, whether this drug has any allergic reaction, whether this drug has any black box warning, whether this drug is teratogenic or cannot be given in pregnancy, or whether this drug has any drug-drug interactions, something serious. So, and also any exceptional information which is not common in that class of drugs. So you have to know about these things, and these are the minimum things you have to know. And then third thing is you have to review your notes frequently. So go back to your notes, because whatever we have learned, say today, after 24 hours you will forget 80% of the information. So that's why it's very important to reinforce these concepts, so which will consolidate all the information. So you have to go back and study again. Just go back to your notes, it will help you to remember things better. And my fourth tip is take practice test before the real test. Okay, so these practice tests can be available from your instructor. They are also available in the textbooks, and also the pharmacology.com website also have some practice tests. So before the real test, if you take practice test, it will help you to find out your weak areas or what are the muddy points. So you can go back and study those areas and strengthen those parts. So it will save you time to prepare for the test. Number fifth tip is related to memorization. So your handwritten notes should help you to memorize things. If you need to memorize more things, I understand that sometimes you cannot avoid memorizing. So you can use different types of techniques. Like one of them is using flashcards. Write down your flashcards and carry them with you. So like in one side of the flashcard you write down the drug name, on the other side of the card you write down some information about the drug, like the side effect of the drug or the brand name or the whatever you want to memorize. And then also there is another technique that is called mnemonic devices. So you can use some kind of mnemonic device like benzodiazepines, which are safe for liver disease, lorazepam, oxazepam, and temazepam. So you can try to remember this acronym LOT, L-O-T. So if you remember this acronym, you will remember that these are the 3 benzodiazepines that are safe in case of liver disease. So if you're interested about learning these mnemonics, I would suggest you can read my book. So this is Handbook of Essential Mnemonics in Pharmacology, available from Amazon. And my last tip is get help. Okay, so if you are struggling in pharmacology, talk to your instructor. So ask for his or her advice, and if you have any confusion, it's better to have face-to-face meeting. Otherwise, if it's not possible, you can seek help from your peers, someone who is doing well in pharmacology. They can help you. So that's the thing. These are my 6 tips to study pharmacology. If you like this video, please subscribe to this channel and share with your friends. Thank you.